And welcome, everyone. This is Dana Devine. That's me. I'm the Community Engagement Specialist for Equal Hope, and I'm so glad you had time today to join our podcast. We'll be talking about breast cancer survivorship, and I'd like to introduce tonight's guest, Dr. Sheri Prentiss. She is a board-certified physician, a public health expert, a best-selling author, an inspiring breast cancer survivor, and founder of the Live Today Foundation. Everybody, no matter where you are, put your hands together for Dr. Prentiss. Hey!
Hi, Dana. Girl, it's so good to see you.
It's good to be seen, Dr. Prentiss. Good to be seen. I'm looking at you, girl. I see you out here living your best life. If you're not in Africa, you're in Egypt. If you're not in Egypt, you're on the West Coast. I mean, you are moving around.
You got to keep it moving, honey. When you get through a diagnosis like breast cancer and it changes your life, you learn how to live.
Okay, we can stop right there. Ladies and gentlemen, that's the end of the show right there. She summed it all up. All you need to do is live your best life. Do not let those roadblocks get in your way. I like that so much. But we're going to get into it real fast because this time goes so fast. So Dr. Prentiss, tell us a little bit about yourself.
Well, I was born and raised right here on the south side of Chicago, family of, I had 3 siblings. My parents worked hard. I received all of my education in the Chicago public school systems year. Went to Northwestern University for my undergrad and graduated from Loyola University Stritt School of Medicine with my medical degree some 32 years ago.
Okay. And so, we always think like, I don't know why you think doctors are not, they don't get cancer or anything like that. I don't know. I know that's stupid and crazy, but I'm sure being a doctor helped you understand a lot more in your journey than others. So let's talk about that journey. When were you diagnosed and how did you find it and all of the stuff that goes with that?
Well, I'll never forget it. October 1st, 2008, I was at home performing my own self-breast exam because, hey, you got to know your girls. If you don't know them, you don't know if anything is different with them. And I simply was doing my, checking out my breast and discovered a lump right in my right breast that had not been there before. I had my baseline mammogram just 6 months prior. And I knew as soon as I touched it that it was cancer. I'm not a pessimistic person. I'm not a fatalistic person, but you know your body. And I was diagnosed with stage 2A invasive ductal carcinoma. And I underwent a partial mastectomy where they removed half of my right breast. I underwent 15 rounds of chemotherapy and 33 treatments of radiation before I was given the all clear, ring the bell, you are free of cancer. And that diagnosis changed my world.
Yeah. And it's funny because you know the date, honey, you probably know the time when they called you back.
I do.
Yeah, that's a date you definitely never forget. Can I ask, so you said you have been going to get regular mammograms?
Yes, always. It's something that as a physician, I would always encourage my patients. I'm an occupational and environmental medicine physician. So preventive medicine is part of my field of study. So all of the screenings, whether it's for breast cancer, cervical cancer, prostate cancer, these are the things that I educated my patients on, making sure you get screened. So I wasn't one of those doctors that was a bad patient. I always was a good patient. So I went for my screening and my screening said everything was okay. But that's why it's important to do it all, to know your body, to know what feels normal and what doesn't. Because I knew what the test results said 6 months prior. And then now I know what I felt. And I acted immediately. I didn't wait. I acted immediately.
Yeah. So 6 months prior to you noticing a lump, you had a mammogram?
My first baseline mammogram. Yep. I had it at 40.
At 40. The protocol number, ladies and gentlemen, 40 is the number. Had there been any cancer in your family? You have history of it?
Had not. I was the first diagnosed. But unfortunately, I was the first, meaning there were others that came after me. But when I got diagnosed, everyone looked as if, oh my gosh, then I know what's the hope for the rest of us, because I was considered that the healthiest, most active person in my family. I really didn't have significant risk factors except for the fact I did start menstruating at around 11.
Mhm.
But my biggest risk factor was stress. It was stress.
Mhm.
And that's a big one. So it's one of the ones I kind of preach to the choir. Don't think that you can do everything else and maintain your lifestyle modifications, with the exercising and decreasing and watching your alcohol content and stop smoking. All of that, yes, is necessary and crucial, but please do not underestimate the cost of stress on your physiological changes in your body.
Bing, ding, ding, mic drop again. But ladies and gentlemen, good night. I hear you so much. So okay, you're a doctor. We assume that you made. Well, were you practicing?
I was actively practicing. I mean, I had been practicing at that time for 14 years,
Mm.
14,
What was
15
your
years,
what
doing
was your
what I wanted to do.
so what was your initial reaction when you
My
heard it?
initial reaction was shock, simply
Mhm.
because I had just finished walking a friend and a colleague and a coworker along
Mhm.
this breast cancer journey. Held her hand. I went to all of her doctor's appointments with her plastic surgeon's appointments, the breast surgeon, the med onc, the radiation onc. I was the one that
Mhm.
helped to ask all the questions. I was the one that filled our team in on her care so that she didn't have to worry about telling everybody how she was feeling. I was kind of like that go between. And she literally handed me the baton and said, I'm good, Sheri. I am straight. I am set. She did so probably about May or June of that year. And this
Mhm.
was October 1st. It was the last thing I expected to hear. The last thing I expected to find. I expected, I was going to feel my breasts and they were going to feel the same. But like I said, as soon as I felt that, I knew something wasn't right. But because I had been on that journey with her, guess what? I had a
Mhm.
book full of names, and I had full of home phone numbers and cell phone numbers. So I immediately called my friend's breast surgeon at home and said, "Look, Barbara, I found a mass, honey. You got to tell me, what do I need to do?" And in that moment, I had to tell my breast surgeon and every other doctor that I came in contact with, please see me as a patient. I want you to forget my MD and every other initial you may see behind my name. Right now, I am a patient. Don't assume I know anything, because that word rocks your world. And when people make assumptions about what they think you know or what they think you should do, in the cases of a life-threatening diagnosis like that, you got to assume everybody's at baseline. It doesn't make a difference your level of education, your experience, or how many times you delivered the diagnosis. Receiving the diagnosis is a whole different ballgame.
So okay, absolutely. Now, here, you brought up a really good point. You wanted to be treated as a patient and not a doctor who knew information. Well, did you feel at any time, on this show and in previous shows, we talked to so many patients who may experience all type of socioeconomic barriers. I mean, they are not treated the same for A, B, C, D, and E, and a lot of it may be systemic racism. But as a doctor, did you feel, or did you notice, or did you say, wow, I get it now about hardships or anything like that? Or maybe you were treated maybe just a little differently because you were a doctor and no one really just kind of brushed you off. Or did you have any hardships that you experienced that you never thought you would have?
Yes. And I would say yes to both. Yes, I did receive treatment and exceptions that I would not have received as a layperson. And I'm gonna admit that I had all of my treatment at a facility where I was the program medical director for their entire occupational and employee health departments. So one, I was known, and two, I went to a facility that I was very familiar with because I worked there, right? So they gave me an in, but having that in and that diagnosis made me even that much more aware of what it possibly feels like for a patient who doesn't have the medical knowledge, who doesn't have the contact with department heads, who is going to a facility, where they may have gotten their annual physical exams, but now they're showing up there every week. They're going to different departments. They're being tossed around, and to not have somebody in your corner, like an excellent patient navigator or an organization where you can call and get additional questions answered. The angst of what patients go through really hit home for me. It really struck home for me. And there were times when I did have to fight for myself. There were times when, I signed up for a clinical trial because I know how important it is as a Black woman and as a minority to self-include yourself in a clinical trial, because too many times our numbers are abysmal in clinical trials. And so I went in knowing to ask the question, are there any clinical trials going on, right? And so, yes, I got hooked up with one. But as it turns out, I had to be that go-between between the clinical trial coordinator and my health insurance, because my health insurance was pushing back on paying for my standard of care because they thought, oh, I'm part of a clinical trial, and now you're not getting a drug that is covered by us. And now I had to explain, no, I'm getting all of the standard of care. They are just adding this drug on. And I don't even know if I'm getting the drug because it was a double-blinded study. And I had to fight for months to get almost $60,000 wiped off of my medical bill. But that was because I knew the language. I knew who to call. I knew who to talk to. And again, I can see from a patient perspective how tragically scary something like that must feel to anyone going through that. And you think you're doing a good thing by being a part of it. So yeah, I faced some things, and it was many of them. Some of them was because of the color of my skin. Because everybody didn't know Dr. Sheri, or Dr. P as they called me. And I was just seen as a patient. And you could tell by the ones that where you was just a patient, where they did not necessarily carry the same type of emotional intelligence and compassion should be expressed to all patients.
Eesh. Wow. So now how many years out?
I am 16 years out, going on 17. Yes.
Yeah.
Going on 17 years
So
out.
you reinvented yourself. Do you feel like you reinvented yourself?
Yes and yes, I did, and I feel it 100%. Because when I came through, for me, one of my biggest challenges, I made it through all of the treatment, right? I went through life happening while I was going through treatment. My mom died while I was going through chemo. I was divorced. Life happened, and I continued to work. I missed only 3 days of work while I was in the hospital. But what really changed it for me was when I finally got through treatment and I'm moving on with my quote unquote new normal. And I hate that term because I don't know. Normal implies what? I don't know if anybody's really normal.
Right.
But I woke up one day, and for a few months probably, I've just been feeling like, oh man, my right hand just feels tight. But I look at it and it looked the same, but it just felt tight, like it was about to pop. And I was having symptoms of neuropathy with the pain and numbness and tingling and the burning sensation in my hands and my feet. And I had gotten accustomed to that, but I'm like, this sensation was different. And then I kind of looked at my hand and my fingers, and I'm thinking, oh, wait, I think they're a little swollen. And lo and behold, Lymphedema had set in. And unfortunately, none of my wonderful physicians, to this day, they're still wonderful physicians, but none of them had mentioned to me the risk of acquiring lymphedema as a result of my breast cancer itself and or its treatment. And now by the time I saw it and seeing visible swelling, now meant that it was irreversible. And that's what really rocked my world and truly caused me to have to reinvent myself because the lymphedema left me disabled from clinical practice.
Yeah,
Yeah.
right. Wow. Um, I didn't even realize it was reversible.
Yes. Listen, and this is what this is honey, this is
Talk
my
to me.
soapbox. Okay.
Mm,
Lymphedema, first of all, is a condition that occurs when your lymph nodes are damaged. They can be damaged or destroyed. And in the case of cancer, cancer itself can destroy them or damage them. Your surgeries with removal of lymph nodes to, stage you, the chemotherapy, radiation, or if you've had them all of them together. And what happens is your lymph nodes are part of your immune system. They help control, swelling and inflammation. And so throughout the day, normally, you may hit something or bump something, you're carrying your purse, you're carrying your backpack, you're typing. All of these things are areas where you can develop micro trauma. Sometimes you may notice where you can put on rings easily in the morning and then you get home and you're trying to take them off, it feels a little swollen. But after you wait a little bit, it's like, oh, I can take the ring off. Well, that's your
right.
lymphatic system doing what it needs to do. But when your lymph nodes are destroyed, your lymphatic system becomes blocked. That lymphatic drainage cannot occur like it's supposed to. So now there's an extra buildup of lymphatic fluid. And that's what happened in my right arm, hand, and fingers because I had lymph nodes that were removed and were positive for cancer throughout my treatment. And it occurs in stages 0, 1, 2, and 3. In stages 0 and 1, if you are in a proper lymphedema management program where you're being monitored on a regular basis, that means you get a baseline before you start any treatment. So we can see what your limbs look like on either side before we even do anything to you. And then every 3 months, we're monitoring to see if there's any shift or change in your right side versus your left side. With the right detection method, you can catch it in stages 0 and 1 before you ever even see any swelling. And then with simple at-home intervention, putting you in a compression garment like a sleeve or a gauntlet or a glove, worn for about 4 weeks, 12 hours a day, studies have proven that 92% of individuals, when they are caught in stages 0 and 1, they do not go on to develop chronic disabling lymphedema like I did. 92%. And when 82% of breast cancer patients will be impacted by lymphedema, sorry, docs, everybody has to be having a conversation with patients because it's
Mm,
preventable.
wow. Well, we learn something new every day. I don't know if I knew that. I don't knew that. Is that so? Tell me about live the Live Today Foundation. Do you guys is that a tell me what about the organization?
Well, after I got diagnosed with lymphedema, and it rocked my world, the Spirit of the Lord laid upon my heart that I was to live. And I didn't understand what live meant because I felt like, well, aren't I doing that? I survived the cancer. I survived all the treatment. I'm living with this lymphedema. Aren't I living? But live became love yourself and others, inspire those around you, voice your dreams and ambitions, and enjoy life. And so live today kind of became my motto, and actually it's my trademark motto. But when lymphedema set in, and I could not perform the clinical functions of my job, and I became disabled from a job I wanted to do my entire life, I realized now firsthand that lymphedema can change your entire survivorship and what it means to live after cancer. If you are an esthetician, a beautician, an accountant, if you use your hands in your work and or career, lymphedema can derail you.